Hello, my name is Chris. I'm a wound care nurse, and I'm going to be showing you how to apply a wound vac. Prior to placing your wound vac, you will need a couple essential supplies, such as your inpatient wound vac, your dressing change kit that includes vac sponge, vac drape, and vac tubing, as well as your wound vac canister. You will also need some essential supplies such as skin prep for peri-wound, gauze, and normal saline for cleaning, as well as bandage scissors. There are two different types of foams to use with the wound vac. There is the white foam and there is the black foam. The black foam is used for underlying structures such as muscle, subcutaneous tissue, and fat. White foam is used for all other anatomical features. Prior to placing the wound vac, we need to prep the wound and the peri-wound. We need to ensure that the peri-wound is clean and dry. We will then apply a layer of skin protectant to the peri-wound area. This ensures the skin is protected as well as helps the vac drape adheres to the area. Obtain your vac drape and cut them into strips as shown. The strips are numbered 1, 2, blue. We are now going to frame our peri-wound using our pre-cut strips. The peri-wound is framed to protect the skin from maceration as well as trauma from the vac sponge lying on it. You continue to frame the wound as shown. And you can use as many strips as you need to fully frame the wound. As the peri-wound is now fully framed and protected, we can now cut our vac sponge slightly smaller than the wound cavity itself and gently place it to the wound bed. This does not need to be exact, it just simply needs to be slightly smaller than the wound cavity itself. Gently insert the vac sponge to the wound cavity and ensure that you have packed any tunnels and or undermining areas. Now that the vac sponge is within the wound cavity, we are going to cover the entire area with some vac drape to ensure seal for the negative pressure system. This will be done using a piece of vac drape that is slightly larger than the wound margins itself. Cover the entire area. Gently pressing the drape into place. Now that the wound is fully draped, we will cut our hole in the middle. Now that our wound area is fully draped, we will make our hole for our track pad. The The hole needs to be approximately a dime to a quarter size. As you can see on our trackpad here, the opened area is approximately a dime size. As we place our trackpad, we need to ensure that both of the holes that we cut, as well as the one in the trackpad, line up accordingly. And gently place the trackpad into place. Ensure that you're assessing for possible pressure points, such as where this trackpad is here. And if needed, you can bolster your foam as necessary to allow for proper offloading. Now that our trackpad has been placed, we will connect the wound vac canister as shown. The wound vac canister tubing connects to the trackpad tubing with a simple push and twist. We will now turn the wound vac on. Now that the wound vac has been turned on, it will automatically go to this screen here. You are always going to press vac therapy. You want to ensure that the wound vac is set at 125 millimeters of mercury, low intensity, and continuous mode, unless otherwise ordered. You will then press OK, and the vac will initiate therapy. Assess that the vac is functioning properly by looking at your seal check here, as well as visualizing the wound bed for proper seal.